Welcome back. So fatigue is one of the top reasons that patients visit their family practice physician. And perhaps no one knows that better than Baptist Health's Dr. Janelle Dawkins with Sherwood Family Medical Center. Doctor, welcome. It's always so nice to have you here.
My pleasure.
You always look great.
Oh, thank you. You do too.
Oh, thank you. And today we're talking about fatigue, which is different than just being tired.
Correct.
It's a different thing from, oh, I just ran a few miles, I'm feeling tired.
Right.
So explain what this fatigue is, chronic fatigue,
right,
and why you're seeing it pop up so much.
So we're seeing it pop up a lot, and just like you said, a lot of people know what fatigue is, right? It's this feeling of feeling weary and feeling exhausted. There are different categories of fatigue.
Okay.
There's physiologic fatigue, like you were talking about, Cassandra, where it's normal for you. This is in a normal, healthy human being that you'll feel this, right? It's just an energy imbalance. There's also secondary fatigue, which comes from a chronic medical condition where fatigue shows up as a symptom.
Okay.
And then there's chronic fatigue, which happens after you've had fatigue for about 6 months.
So how does someone know the difference between, gosh, I'm just really tired lately, or I might be suffering from chronic fatigue? What's the difference?
Right. So there's a definition, right? So chronic fatigue is anyone who's been constantly fatigued for more than 6 months. That's the first thing, okay? And then for someone who wants to know if this is just normal or anything, look at the things that are keeping you in balance. If you know you haven't slept for 2 nights, sleep.
Right.
Try and sleep, right? And if you get some sleep and then you feel better, then you know it's your sleep. If you've changed your diet, or if you've been out on these days when Melinda is telling us it's red hot and you haven't drank enough water, and then you drink some water and you feel restored, then you know it's something physiologic.
Okay. So how can you treat chronic fatigue? If you've got some of these underlying health conditions, or you know, some of those that were listed earlier, you're dealing with that, and that makes you also tired. So how do you get the help that you need to fix the fatigue issue? Because we know that that can be debilitating for a lot of people.
Yes, it most certainly can. So secondary fatigue are the ones that are caused by chronic medical conditions. So you speak with your primary care physicians about controlling whatever disease process is there. And then we have to do labs at certain times, you know, especially our patients that have anemia or thyroid disease. Some patients have metabolic imbalances where they just have their calcium being off balance. And just getting little things like that in balance often helps with fatigue.
Okay. So I had a recent just yearly well checkup, and one of the questions that my doctor, I'm 41, she asked me, are you feeling tired? And that was the first time I'd been asked that question. And I feel like women in particular, maybe 40 and older, we feel a lot of fatigue in general. And you're saying that doesn't necessarily mean you're tired. It's a mental thing. It's a spiritual thing, stress. So talk about that.
Right. So often I have a lot of patients that come in and they're talking to me, and I don't think they realize that fatigue is more than just your physical body, right? It's more than just feeling this exertion that you feel after exercise, for example. But a lot of it is actually mental health and spiritual health that we're not concentrating on, honestly. Especially after COVID, a lot of people have been through very life-changing situations, and it dawns on you, right? So that's one thing that we have to be aware of as a society, both males and females, is your mental health and your spiritual health.
Sure, it's all connected.
Yes.
All right, so if you're feeling tired more than usual, it's an ongoing issue, the best thing is to reach out to your primary care physician. All right, that's Dr. Dawkins. Thanks so much for joining us. You can contact Baptist Health by going to baptist-health.com or calling the Baptist Health Healthline at 1-888-BAPTIST.